Okay. See the screen?
Yep.
Perfect. Okay, so let me start off here with some facts about franchise benefit solutions. We've been in business for over 35 years. Matter of fact, it's probably pretty close to 40 years now. I've been in the business for a little over 40, and my experience is mainly in the employee benefits. We specialize in the marketing administration of benefit solutions, targeting the franchise community. Franchisees is our niche. We generally don't work with businesses just down the street. It's our niche is like our name is, franchise benefit solutions. We provide exclusive national and local plan designs to multi-state companies with employees across the United States. Over the years, we've had the privilege of partnering with Authority Brands, Valpak, Comfort Care, Grocery Outlet, The Joint Chiropractic, and Jenny Craig, amongst others. In recent years, the insurance industry has witnessed many changes. Our clients are aware of the changes going on, and many have expressed interest in offering alternative benefit plans to help recruit and retain employees. So what makes us different than most local brokers? We understand the franchise industry. Again, that's all we work with, so we understand what it takes to be a franchisee. We focus on building benefit strategy and developing long-term relationships. We help you with training and support for prospective franchisees. A lot of franchisees come from the management world, don't understand how to run a business. So we would help you with the back office with prospective franchisees that come in. We offer you an online quoting portal, which allows the franchisees to obtain instant quotes from multiple insurance carriers. This would be on the individual side. And we would provide you with a branded web page linked to your corporate site, outlining our products and services that are available. So why do clients choose us? As you can see here, we have a few referrals from Valpak Sports Club, which happens to be here in West Bloomfield, and Grocery Outlet, which they're mainly out west, but they're starting to move towards the east part of the country. Our advantages: we offer affordable group plans, all with guaranteed acceptance and no waiting periods. Plans and rates are the same no matter where your franchisees are located. If you have a franchisee in Florida, Michigan, Washington, California, the plans and rates are the same. There's no
Sorry, what about, like, I just happened to think about this when you said guaranteed acceptance, like pre-existing conditions or something, if somebody's diabetic?
No pre-existing conditions. We take everyone.
Okay.
There's no participation or contribution requirements. Plans can be employer paid, standalone, voluntary, or packaged together through payroll deduction. And this is what you asked before we started. Franchisees can choose the benefits they want to offer the employees, and the employees would enroll online through our online portal. Our program portfolio includes medical, dental, vision, life insurance, accident, critical illness, hospital indemnity, telemedicine, prescription drugs, and short-term disability. Like I said, plans can be employer paid, standalone, voluntary, or packaged together through convenient payroll deduction. So we offer 3 health plan options. The first being individual and family. The second would be comprehensive group health plans. And the third would be voluntary group health plans. Our individual and family health plan, we would offer you our online quoting portal, For those employers that don't want to offer a group plan for their employees, but are looking for an individual health plan for themselves or their family, we offer an online quoting portal they can view at their own convenience. And there are times where the franchisee would only have one employee, but want to look at our online quoting portal. So once the franchisee or the individual would input their personal information, they can compare affordable health plans from different carriers, find out if they qualify for financial help, such as the subsidy, view benefits at a glance, view local providers, and they can also apply online or download in an enrollment form. So as you can see on the screen here, this would be the information they would input into the system. Once they put their info into it, it would come back from the lowest carrier to the highest carrier. And this just happens to be here in Michigan, the Blue Cross. But you'll notice at the top, it also includes what their subsidy would be.
And is that subsidy the
federal marketplace?
federal? Okay.
Okay. And
So
then
this does link into that as well.
correct.
Okay.
But again, there are specific dates when the individual can enroll through the marketplace type program. Would be the beginning of the year unless there's a qualifying event. So as you can see here, this would be the rate after the subsidy. And again, they can look at plan details, view similar plans, find doctors, and then they can just add it to the cart. So this is the individual plan that we would offer. Comprehensive group health plan. If a franchisee is considering their group options, we can help them make the right decision that best meets their healthcare needs of their business and their employees. Group plans are based on the demographics of their company. Along with their employee and dependent ages, we would need a census information in order to provide them with a group plan. So again, this is also based on the ACA because your franchisees have under 50 employees. So they don't have to offer a program, but if they do want to offer a program, a major medical plan, we would need to have census information. So we offer ACA and non-ACA compliant plans. ACA compliant plans are community rated, while non-ACA plans are based on the demographics and the medical history of their employees. Now, you did ask me before about pre-existing. So there is no pre-existing. However, non-ACA plans can be much lower in cost than the ACA plans, but they can reject the group or increase the cost. So before the ACA came into being, the non-ACA plans is what was in place, and they are starting to become more prevalent. But again, you find a group that doesn't have some type of health condition.
Right.
So ACA plans require a minimum of 2 enrolled employees, and they will accept eligible waivers such as Medicare, Medicaid, Marketplace, spousal coverage, or other group plans. Non-ACA plans may require a minimum of 5 enrolled employees and will not accept any waivers. For example, if a franchisee has 15 employees, a minimum of 7 employees are required. We don't really write many non-ACA plans. Most plans, if we're going to put in a comprehensive, will be the ACA plans.
And does that subsidy apply here as well?
No, does not.
Okay.
This would be the type of program where the employer will contribute towards this because they're looking for a comprehensive plan. Because let's say most small groups are going to be mom and pop shops.
Mm-hmm.
And then they'll have 1 or 2 employees. So if they have, let's say 10 employees, they have management where they may have 2 employees plus themselves. So they'll put in a management carve out, and then they'll put in a comprehensive for the management, and non-management, they'll offer our voluntary program. So again, the employer can set it up any way they want.
Okay.
So our voluntary group medical plans are a little different than the group plans. So far, I've covered 2 of our 3 healthcare options, individual and family, and the comprehensive. Our third and most popular option is our low-cost voluntary group health plan, similar to an association health plan. Our voluntary MEC and limited medical plans are all about access, easy, low hurdle access to the healthcare system, otherwise unattainable for many employees. The basic MEC, as you can see here on the screen, covers preventative services only. As you can see here, covered 100%. It covers wellness preventative services, which include the exam, immunizations, blood pressure, diabetes, cholesterol screening, flu shots, anything to do with screening. Colonoscopy and mammogram screenings are also covered. So the average cost for a exam is about $3,000, and it's covered 100%, and it's ACA compliant. Okay, so it does fall under the ACA. You can see the cost here is $58. Generally, what we'll see, the employer will contribute to $58 to cover the, at least provide them with a exam. And then if they want to upgrade to our other plans, they could do that. So what I've explained is the basic. The premium MEC, or I should say the MEC Plus, covers preventative services, primary care, and specialist visits, along with urgent care, lab and x-ray services, and generic prescription drugs. So simple copay. It falls under the PHCS network, which is a national network. And I looked at my doctor. If I'm going to offer some, I want to make sure my doctor is part of it. So this is simple copays. 15 for primary and specialists, urgent care is 50, lab and x-ray is 50, and generic drugs $15 copay. As you can see here, cost is 109. A comprehensive plan, and I will tell you, we wrote a joint chiropractic in Texas. I think it was in the Houston area. A single rate for comprehensive was between $500 and $700 a month for a single. What we did is we offered the doctors the comprehensive, and then the other employees jumped on the voluntary program here. Just because of the cost, they couldn't afford the cost of the comprehensive, but it seems to be more affordable with the MEC plans here. So the premium MEC and super MEC plans include value-added benefits, which is a cash benefit payout to help avoid a financial crisis. So as you can see here, the premium MEC and the super MEC have additional value-added benefits. Now remember, these are benefits that are paid to the member, not to the provider. So this is through an AFLAC type program.
Okay.
So hospital confinement under the premium will provide a $200 a day for hospital confinement. Accident treatment, $100 benefit. Ambulance, $200. Diagnostic testing, critical illness. Now, these MEC plans up here do not cover inpatient, outpatient, or emergency room. That's why the cost is so much different.
Okay.
Okay. I will tell you that our enrollment percentage-wise is about 90% on the voluntary side here with the MEC plans versus a comprehensive plan.
Wow. Okay.
It used to be 4 years ago, it was switched. It was probably 80 to 90% was or was the comprehensive. Now, because of the high cost, it's translated over to the voluntary. So again, employer participation is not required. Employer contribution is not required. It's the same plan, same rate in all 50 states. Okay, so these are calendar year rates. Boy, my throat is dry here already. The value added benefits here is a cash payout to help offset gaps in medical coverage. So we're not making it as if it's 100% covered. We're just trying to offer some type of benefits. You know what? Why don't I hold on here for 1 second? Let me grab a.
Absolutely, go right ahead.
I'm going to put this on hold. Okay, sorry about that.
No, not a problem.
Okay. We also offer a voluntary limited medical plan. And what this is, while not comprehensive like major medical plans, a limited plan will help defray some of the out-of-pocket costs associated with major medical. So what I already showed you on the MEC plans is a simple copay. The limited plan is a little different. This plan here may offer more benefits, but there could be a balanced bill. For instance, the preventative services are covered 100%, same as the MEC plans. Primary care, it will pay $60 benefit per day to the member, maximum of 4 per year. So if the cost from the doctor is $100, this plan will pay $60, so there could be a balance bill of the $40. Okay, it is a PPO plan, so it will be discounted because it is a network plan. But it is a balance bill type program. I would say we probably enroll about 80 to 90% with the MEC plans because it's a simple copay and people understand the copay. Here, they may not be well educated when it comes to what the doctor costs are or services are from the provider. Now, the doctor generally will ask you what insurance you have, and if you present the card, they'll ask you to assign it to them, which you could with this program. But again, it may be a balance bill. So it does offer a little more services such as outpatient lab, outpatient surgery, anesthesia, hospital emergency room, urgent care, hospital room and board, hospital admission, prescription drugs. And as you can see here, the cost is a little cheaper than the MEC Plus. But again, it's the balance bill versus the copay. So we leave it up to the employer what direction they want to go. We do have some employers that will offer both together and then offer it as one plan, but then contribute towards it. So again, it's up to the employer how they want to set it up. Additional voluntary group plans that we offer. Dental, we offer 4 plans. They can choose any dentist. The advantage of our program is we have no waiting periods. So a lot of dental programs will say you have to have a 12-month waiting period for major services, whereas we have no waiting period. So we'll take you from day one. Vision, we offer 4 plans, 2 from VSP and 2 from IMED, which are the 2 top carriers in the country. Life program, we offer an employer group plan of $10,000, which would be employer pay. And then we also offer a voluntary plan, which is employee pay up to $500,000. You can purchase on the spouse and children and guaranteed issue amounts. Again, no medical questions. So we'll take, we do have some where the employer, day one, they jumped on here because no health questions. We offer a telemedicine, which obviously with the pandemic and everything of late, telemedicine has become a major enrollment program for us. So let's say you're at work, like you had the flu, you felt sick, you really couldn't go home, you wanted to call the doctor, you can use the telemedicine. It is through Teledoc. There's no co-pays or deductibles. You talk to the doctor, give them your symptoms, they'll give you a diagnosis, and they'll even call in a prescription for you. Beginning this year, mental health benefits were added. You can connect by phone, video, or app. My son had something in his eye, and he uploaded the picture of his eye and called the Teledoc, and they called in a prescription for him. So I know it works. It's
yeah.
unlimited for all franchisee members, up to 5 total. And I think the cost is around $11 a month. Now we offer an accident plan, which covers inpatient and outpatient. Now, generally what we see on these voluntary plans here, the employer doesn't contribute. The employee contributes 100%. Okay, so there's an accident plan. It is through AFLAC. Plans and rates haven't changed since 2014. We offer a critical illness, 2 benefit amounts, $20,000 and $10,000. Covers up to 20 different illnesses, and they pay on the day that the employee is diagnosed. Hospital indemnity plan. Now, this hospital indemnity plan, employers will package it with the MEC plan. They'll contribute towards the MEC plan, but will offer the hospital indemnity employee pay. It covers both injuries and sickness. It has an admission and per day hospital confinement benefit, which is included. Outpatient medical treatment in a hospital emergency room and physician's office. Surgery and anesthesia benefits, diagnostic testing, prescription drugs. We offer 2 hospital plans that can be packaged with the MEC plan. Short-term disability, 3 monthly options. Plan pays 60% up to the benefit option they select. Plan will pay up to 6 months. There is a 14-day waiting period before benefits begin for both accident and sickness. We do get quite a few that select the short term, and when they want to claim on it, they didn't realize there's a 14-day waiting period, and then all of a sudden there's people that are upset. So we do let them know there is a 14-day waiting period. Discount prescription mail order is included. There's no cost to it. Savings are up to 80% on prescription meds. It is through the Canadian med store. It's a 90. They'll provide a 90-day supply. I know this plan works. We had a client from California tell us they were paying $1,400 and they were able to get it down to $400 a month. So I know the program works. Additional services we offer: consolidated billing, online HR services, Section 125, premium only plan, which allows payroll deduction, and COBRA administration. Our benefits enrollment platform includes 4 steps from the initial contact of the franchisee to the ultimate enrollment. Step 1 is discovery. The first step is to identify the employer's objectives of offering benefits that reflect both the employer and the employee needs and budget. We will gather the group information, discuss the employer's goals, benefit options, and their budget. Step 2, which is the analysis. It's important for the employers to be strategic when deciding what to offer. We will review their benefit options and help set up a benefits program that will help the employer attract and retain employees. So this is where we obtain the quotes and then present them the benefit options. And then from there, we formulate a benefits plan with them. Step 3, once they decide they are going with our program, we set up their communication strategy, which is a critical component to the benefits planning and management. We will develop easy to understand benefits communication for the employer to share with their employees. So we will provide them with a enrollment guide that they can distribute to their employees. And then this is where we build out a online enrollment platform, which would be step 4, the enrollment. We will provide them with a enrollment platform that will allow the employers to spend less time collecting and reviewing forms and communicating benefit details. So what we do is we set it up, share it with the employer, what the platform looks like. They provide us with the census. We upload it. We send out login information to the employee. They go in, they register, and then they go through the enrollment process. We do require the employee to e-sign their enrollment, because then it is synced with the carrier on the enrollment. For the employees, they can select the benefit options that best suit them to their specific needs. So once the employees enter their demographic information, they can go through and select the plans through the initiative wizard. It's a one application, one bill, one online enrollment, and an administration system. So as you can see, from step 1 all the way through step 4, this is how our benefits enrollment platform, we work with the franchisee.
So the franchisee could say, I'm going to do X, right? So you build everything out. And then the employee could go in and say, okay, I get X, but I also want Y and Z. And so I'm going to opt into those and pay for the additional myself on those.
Correct.
But then another employee could just say, I just want X. I'm good with X. Thank you, Mr. Employer.
Yep. So if you want just dental, you just want the dental and say, that's all I want, fine. The next employee says, I'll take the MEC plan, I'll take dental, vision, life, fine. Next employee says, I don't want it at all, they waive it.
Okay.
So looking ahead to 2023, there are 2 types of special enrollments. The first one is the individual, which is the marketplace, the Obamacare. I don't really need to get into that because I think everybody knows about it. The other special enrollment is the group special enrollment. This is under the ACA. It's between November 15th and December 15th. So under the ACA, carriers are required to offer an annual group special enrollment period to employers who do not meet participation or contribution requirements. So under a normal comprehensive plan, you have to have 50% participation, and you have to contribute 50% of the single rate. Under the special group enrollment period, you don't have to meet either of the participation or contribution requirement. So this is the one time a year. We enroll probably close to 100% of our business, somewhere around there, during this 30 days. Mainly because this is the time there are no requirements at all.
Okay.
So the only thing we require under this is 2 full-time employees, 2 W-2 employees. It could be the employer and 1 employee. Again, this is for the comprehensive, not the voluntary. Okay, this is where the employer says, I want a comprehensive medical plan. This is the time to do it if they don't qualify during the rest of the year.
Okay.
So what are our most popular solutions to help your franchisees hire and retain employees? Package 1, which is the most popular, the employer offers dual MEC plans and contributes towards the employee-only costs. The employee contributes the balance of the employee cost plus dependent cost and any buy-up plan. Okay, so they'll offer two. They'll pay towards the low plan. The employee contributes whatever the employer doesn't, dependent cost and any buy-up. And generally, the employee will buy up. Then the employer offers voluntary benefits at 100% employee pay, for the dental, vision. And again, you see I highlighted in bold the hospital confinement, because this is where they try to package together. But again, the employee contributes 100%. Package 2, the employer enrolls in a management-only group health plan through the special enrollment period. The employer will contribute 100% towards ownership, and management, they may contribute 50%. So as you can tell, it's a management carve-out plan.
Mhm.
And then the employee offers the voluntary benefits to non-management at employee 100% cost. Okay. Package 3, the employer enrolls in a comprehensive group health plan. The employer, now this is offering it to all the employees. The employer offers dual medical option and contributes 50% of employee cost of the lowest plan. The employee contributes the balance of the employee cost plus dependent cost and buy-out plan. Okay, does that make sense?
Mhm.
And then the employer offers the voluntary benefits, 100% employee pay. In package 4, the employer offers voluntary benefits to all employees, 100% employee pay. So really what you see here, other than package 2, because it's the 30-day window,
Right.
employer can set up the plan any way they want. Okay. I mentioned about helping you with the training for prospective franchisees. What we try to do with your franchisees is to suggest why offer benefits to their employees. Many prospective franchisees come from the corporate world and aren't trained how to run a business. We will help you with educating your prospective franchisees with why they should offer benefits to their employees and help them set up a strategic benefits plan. In today's hiring market, benefits are essential for attracting and retaining employees. Once
I
the,
know all of these. I apologize. I have a hard stop
okay, that's fine.
now.
Now, to set up a program, we would develop a program brochure, set up the branded page, provide the online quoting, develop additional marketing resources, and then we would offer you an introductory webinar for all your franchisees to attend to show them what's available. And we're talking about 2 to 4 weeks.
Sure. And is there a central person that they work with? Is that you? Is that somebody else? I mean, if they say, yes, we want to go, and then they get through this, but then they have a question. I mean, will there be a central person that's working with all of our franchisees, or is it just a call in and you may get Sue one day and Ken the next?
Generally, no, we would assign a sales rep that
Okay.
that individual would work with. And, if need be, I'll jump in to help the franchisee. So there would be someone to help. So here's the branded page we would set up. And that's pretty much our
Okay.
program. And again, I will, since it's being recorded, I'll save it. I'll send it to you, review it. Now, again, what you may want to do is once you speak with your advisory, if you want to set up a test program and have a few of your franchisees reach out to us, I will work with them on the initial so that they understand, and then they're going to report back to you.
Okay. So actually once you stop the recording, if you will.
There we go.